So info I have is I'm being dispatched to a 21-year-old female whose roommate called 911 after saying her roommate had sudden difficulty breathing. So I walk in, my doorway assessment, I've got a young female who's in somewhat respiratory distress. She's in tripod position. I can audibly hear her breathing, and if you can hear somebody breathing, that's not a good thing. So far, I would not say she is sick yet, but I'll continue with my assessment. Hi there, my name's John. I'm with the ambulance today. What's your name?
Kaylee.
Kaylee? It's good to meet you. Do you mind if I take a seat?
That's fine.
Thank you. So what's going on today?
I just I went outside, mowed the lawn, and 10 minutes into it, I just started having a hard time breathing, getting full breaths.
Okay, and then you came inside and your friend called 911 because she was concerned. While I'm talking to you, do you mind if I take your pulse here?
That's fine.
Perfect. So at this point, I've covered my ABCs. Her pulse is good. She's able to speak to me in full sentences. Obviously, there's wheezing, but I don't suspect a airway obstruction. So my ABCs are covered. I'm going to continue with the rest of my assessment. So, I don't remember if you said, but what were you doing when you were outside?
I was mowing the lawn.
You're mowing the lawn, okay. And do you do that very often, or
No.
is it the first time in a while?
My roommate usually does it.
Your roommate normally does it? Okay. And do you have any medical history? I know you're young, but do you have any medical history that I should know about?
I have asthma, but it's not that big of a deal. I haven't used my inhaler literally in a year.
So is that a prescription inhaler?
Yes.
Okay, and you haven't used it over a year. How often do you have these flare-ups? Are they pretty uncommon? Or?
Yeah. Okay. I haven't used it since last year.
And that was the last time you had one of these flare-ups? Was a year ago? Okay. If you don't mind, I'm going to take some of your breath sounds here. So if you could just take some nice short breaths here. While I'm doing this, I would have my partner be getting some baseline vitals. Okay, now I'm going to have you lean back. I'm going to check the fronts here. So I'm going to note that there's audible wheezing in the upper lobes. So can you take a deep breath for me and just take a deep breath for me? Okay, is it painful at all?
It's just heavy.
Just heavy, okay. So no pain. Does it feel like it's hard to get a full breath?
Yeah, it's my lungs aren't doing their job.
Okay. So are you allergic to anything?
I'm allergic to cats. I'm allergic to ryegrass. I'm allergic to hydrocodone and iodine. And I think that's it.
Correct. So no other medications you're aware of that you're allergic to?
Anti-nausea medicine.
Anti-nausea medicine? Okay. So at this point, I'm going to administer her a 2.5 milligram albuterol treatment based off the differential diagnosis that she has asthma and she's having an asthma attack, an acute asthma attack. She hasn't had one in a while. She doesn't have her prescribed inhaler. So I'm going to give her that treatment to help open her airways, and the supplemental oxygen will also help her. I don't know what her SpO2 is, but I'm assuming it's going to be diminished a bit. So I give her it, and so that's going to be, that's going to be my initial assessment. After applying it to her, I'm going to, wait 5 or 10 minutes, let the medicine work, and then I'm going to continue to reassess, and from there, I would decide, was this an acute thing that she just needs to stay inside for the rest of the day and, not be going outside and mowing the lawn? Or is it acute and it seems like things aren't completely going away, and maybe she needs to go to the hospital and get it checked out, and maybe get another prescription. She wants to continue to recess, every 5 to 10 minutes, and go from there.